This statement, therefore, that I'm reading is a statement that has been put together by the two departments led by the MECs, shared with me as Premier of the province of KwaZulu-Natal. We feel competent, therefore, to answer any questions on matters, whether they are in this statement or they are not in this statement, as long as you see them as being pertinent. I now go to the statement. The KwaZulu-Natal Department of Health has been receiving negative publicity from various stakeholders about the poor health service delivery in the province, one of which was the memorandum issued by the South African Medical Association, in brackets SAMA, Coastal Branch, which was received by the Department of Health during the protest march held by SAMA on 5 May 2017. As the Premier of this province, I wish to acknowledge that the concerns raised by stakeholders are a priority of the KwaZulu-Natal Provincial Government. I've been in ongoing consultation with the Provincial Executive, more particularly the MEC of Health, Dr. DHLOMO, and the MEC for Finance, MEC Scott. We have conducted an in-depth investigation into the administration and management of the Department of Health, and have embarked upon some major interventions. The challenges of the Department of Health are not limited to a specific area, but cut across a number of areas and are linked to competing priorities. In the main, the issues relate to various elements, some of which can be attributed to internal inefficiencies and others that are beyond the control of the department. Many of the challenges in health in KwaZulu-Natal are experienced throughout South Africa. It is important to contextualize the situation the Department of Health finds itself in and the determinants that have a profound influence on the operational environment. These include the economic climate of the country, characterized by high unemployment, high cost of living, fluctuations in the rand as a result of international financial trends, amongst others. Impact on the public health sector in various ways. Most importantly, the rising cost of medicines and medical equipment. Every citizen in South Africa is experiencing financial pinch. Many who used private health care through medical aid are now moving to the public sector, increasing the burden on public health care sector. In real terms, while the equitable share allocation shows an annual increase, these funds do not entirely cover the needs of the Department of Health. The rising cost of medicine and medical machinery means that the budget allocation for health is actually in decline. These pressures will remain during the period of fiscal consolidation, with real financial relief only expected from national fiscus in the outer MTF 2018-19. 54% of KwaZulu-Natal population reside in rural areas, and an estimated 10% of the urban population reside in underdeveloped informal settlements, which has significant implications for service delivery and health outcomes as a result of underdevelopment and unavailability of essential services, adding the burden on the department due to these socio-economic challenges. The quadruple burden of disease continues to have a profound impact on the quality of life productivity, and life expectancy of citizens. The costs associated with the provision of core service delivery in addressing the diseases such as TB, HIV, and AIDS, chronic non-communicable diseases, amongst others, further contribute to the financial challenges. The expansion of health services to more outlying communities and households is yielding positive results for patient care, but this comes at a cost. As articulated by SAMA, the public sector is facing challenges in human resource management, financial management, supply chain management, aging infrastructure, and old equipment. It is within this context that the provincial government has intervened. The health sector is an environment fraught with difficulties, and it is the role of government to address these systemic challenges with urgency and importance. Provincial Treasury has been working very closely with the Department of Health. Treasury resources were deployed earlier this year for a clear assessment of what needed to be done. These include the following: a sector audit on the department's pharmaceuticals and the provincial pharmaceutical supply depot was undertaken by the AG, Auditor General, and identified a number of weaknesses in the department's control, as well as a number of inefficiencies and problems relating to the aging assets that require constant maintenance. Provincial Treasury is doing a cost analysis on the extent of the intervention required. Provincial Treasury will be making a Section 18 intervention in terms of the PFMA to temporarily control the SCM function in the department until such time the necessary financial management controls are in place. The work of Treasury will involve taking stock of all tenders, many of which are running on a month-to-month basis. These will be converted into proper contracts. Government has set timelines. The contract register will be finalized by the end of August 2017, and all tender backlogs should have been dealt with by no later than January 2018. It is planned for all periodic contracts to be finalized by May 2019. Internal controls in the department are weak due to a lack of capacity. Treasury will deploy resources to strengthen this capacity. Immediate appointment of resources from the various provincial treasury panels of consultants will be made available for a period of approximately 8 months. This will be done to identify gaps and shortcomings in the department's internal control environment, to provide training where required, and to assist where required. We believe a credible asset register will be available for 2017-18 AFS audit. Work has commenced to deal with the department's 2017-18 commitments to service providers. Volumes of invoices are being reconciled and verified by the Treasury team. The target date effecting payments is end of August 2017. The lack of maintenance of medical equipment is being addressed. The proposed SCM intervention will focus on how best to procure medical equipment to ensure that maintenance arrangements are strengthened so that the risk of equipment downtime is eliminated or reduced drastically. An IT solution will be found to deal with the management of the National Health Laboratory Services to prevent duplication and an over-ordering of tests. Department will acquire a qualified and experienced IT and data specialist to finalize the interim solution and to develop the interface protocols. If the development is successful, IT hardware will be procured for the clinics. It is estimated that the system will be rolled out to all institutions within 12 months after appointment. The sole shortage of health professionals and clinicians, in particular, remains one of our biggest challenges. Health budget will be reprioritized to ensure that we will fill critical posts. And with the other interventions mentioned above, the working environment will be vastly improved for our health professionals. The HR intervention includes the appointment of the head of clinical unit at Gray's Hospital Oncology Unit. He is currently overseeing the management of patients at both Gray's and Inkosi Albert Ntuli Central Hospital. Accelerating progress on the 2030 Agenda for Sustainable Development implies that we must embark on health awareness campaigns. We can confirm that as a result of our campaigns such as Pietermaritzburg, which is linked to Operation Suguma, more women are coming forward to test for cancer. Some of them require immediate oncology treatment, which as government we are obliged to provide. Provincial government wants to express its appreciation to the oncologists and radiotherapists from the private sector who have come forward to work in designated public health institutions to provide oncology services. We want to pay tribute to the Rainbow Oncologists, a private group consisting of medical oncologists, radiation oncologists, hematologists, as well as oncology nurses trained in chemotherapy administration. They have agreed to provide quality health care to patients at obstetrics and gynecology clinics. Equally, we pay tribute to our health professionals and all categories of staff in the Department of Health who are working hard under extremely hard conditions. We want to congratulate them for adding meaning to government's commitment towards quality service delivery. Provincial government reiterates its commitment to working with all Chapter 9 institutions, including the South African Human Rights Commission and the Public Protector. We welcome the report from the South African Human Rights Commission, and this will be presented before the Executive Council. We want to adopt the recommendations and ensure that a program of action in relation to the implementation is adopted by the Executive Council. This will be communicated with the Commission in line with the Protocol of Engagement. As leaders of government deployed to oversee the administration of state resources, we are committed to working with all political parties and stakeholders of society to address the challenges in the public health sector in KwaZulu-Natal. Following the executive statements made in KwaZulu-Natal Legislature today by the MECs of Health and Finance, provincial government will embark in a meaningful exchange with all stakeholders in the health sector. We urge stakeholders to work with us to identify any further concerns they may have and to find workable solutions. This will be an ongoing process of consultation and assessment. Together, we must put the health of each citizen of this province at the center of our agenda. The challenges are great, but I firmly believe that with the commitment of all, we can look to a turnaround to create a healthy nation and province. I may as well add that I've already started a process as well of talking to individual specialists that we know, that we are engaging with, to deal with how we can make sure that our administration, our management, is fully equipped with the skills of managing and we are certain that there is no area that has been left unattended to. Because all of these matters do indicate weaknesses in the manner in which we manage our affairs in the department. This is going to be a process, as you can see. It's not a once-off event. It will be a process in which Premier, MEC for Health, MEC for Treasury will work very closely together, accounting to the Provincial Executive Council until we are satisfied that there is improvement and there is no need for any further strengthened cooperation. And we are sure that is achievable.
It's not a situation of why this was not done before. Provincial Treasury has been working with the Department of Health for some time. What we've been doing in this interim period is actually a full-blown investigation into the extent of the inefficiencies and problems in order that we can do an intervention. You can't just, as Provincial Treasury, go in and intervene unless you have a full scope of the problem before you. I have allocated resources from Provincial Treasury, very senior resources in terms of personnel that have gone into the Department of Health. And the interventions that you see before you from Provincial Treasury are as a result of that investigation by Provincial Treasury, which, as I said, has been over a long period.
MEC for Health indicated clearly when these problems started and what steps were being taken to deal with the issue of the main problem, which was a dispute between the department and a maintenance company. And that dispute only ended when the contract ended. Now, all of those matters, there is no question that they have been addressed. They have been addressed. The maintenance of these machines that break down all the time, that maintenance contract has been there. It's not like it hasn't been there, and it's been paid for. But the company itself is a company that needed to have been taken head on, and those are issues we are saying should now be the thing of the past, because there is now a new arrangement to go into a new process of maintenance contract.
The issues of specialists in the world, in the country, is always a problem. There may be push and pull factors for specialists to be in the public sector. And we should not shy away from saying some of our challenges here and there of not getting this equipment being repaired on time, being serviced on time, could actually lead to someone else deciding to go on private. But there may as well be some of the specialists who had planned that they will be going to private when they complete. The comprehensive plan that we now have, as it is reflected in the statement by the Honourable Premier, is that the team of oncologists that are at Gray's Hospital, because that one is still fully functional, will go and support the team that is at Inkosi Albert Luthuli. We might as well report to you that we have got 8 what we call oncology registrars who will be writing their exams in September. So all you need at Inkosi Albert Luthuli is just the head of the team to support and strengthen all the others. Was all, as we are saying, oncology treatment needs a multidisciplinary team, but again, the head is an oncologist. So these oncologists that will come from Grace will go periodically on to Inkosi Albert to give that support to move the service forward. Also, you could get from the Honourable Premier's statement that there are a lot of wide range, rainbow oncologists, Hopelands oncologists who will be giving that support. And that will be in place, and that is currently in place. The one thing that we probably didn't reflect on the statement is that there are 2 oncologists who have applied and have been, we can't say we have taken them, but we would want to have them safe to wait for their work permit because they come from Libya. It's a husband and wife. Fortunately, they qualified in this country. So that is in place, and we hope that, because we have always been having these challenges of them resigning, but the sudden issue was when the last two resigned. So we are putting all that in place, and we are very hopeful that the situation will be stabilized by all these processes that we put in place. The workload that suddenly increased at Inkosi Albert Lutulu was as a result of temporary challenges that we were facing at Hilton, which then became a bit of a permanent challenge. You are correct. We are right that the removal of this intermediate tech method, now dealing with the mother company Varian, which they are on the ground, will be difficult for me to tell, but I would imagine these are the manufacturers of these machines, and they have committed and they have promised us that they will look into these machines and get them up and running very quickly. I probably must add this, which I was not aware, I was told by some of the technicians to say, maybe we should have had an oncology service outside Addington Hospital. Because of that hospital being closest to the sea, the wear and tear of machines and equipment is much faster than if it was anywhere else. So you go in there, repair, replace, but at the time unexpected, the machine is already now not functioning, which if it was sitting at Matateni, not that we are moving situation there, but I'm saying the impact of the sea has got a direct impact on a very expensive machine, which when you buy it, you know that this machine has got a lifespan of 15 years. Suddenly you find that because it is sitting at Addington Hospital, it is giving you challenges immediately within 3.5 years. So those are some of the issues that have educated us, but are not immediately saying, let us move the equipment out of Addington Hospital.
For me, the first thing was to try and to go in, do an assessment, find out what it would cost to do an immediate turnaround. And we've got very tight timelines. You know, we want to see some real improvement by January next year. Real improvement. So, you know, you can hold me to task on that. And we do believe that a lot of the problems that have emanated, you talk about maintenance, are we going to be maintaining machines or are we going to buy them? We're going to be doing both. But if we get into a proper maintenance of assets program, then the downtime that the Honourable Premier was speaking to will be reduced, so that you don't wait for a machine to collapse before you maintain it. You have a properly structured maintenance program to ensure that machinery does not become defunct, and once we address those issues, which are the real tangible issues, if you listen to what the doctors said, the SAMA's major concerns is that it's no use putting an oncologist into a unit if there's no machines in which to operate, whether it be radiotherapy or chemotherapy or whatever. And so Provincial Treasury, through its SCM intervention, will address that. So what we are looking at is creating a much more workable environment for our health professionals.
I will just summarize how I understand the Human Rights Commission to be directing the department towards. Clearly, the Human Rights Commission is saying to the department, there are people who suffer from cancer. They have a right to access to health. Then the department is required to make sure that they do access health, and that the department must convince the Human Rights Commission within 10 days after the tabling of the report that there is a clear program to do that. That's in a nutshell what the Human Rights Commission is saying. And then the Human Rights Commission then says the Premier must ensure that this happens. I therefore I'm confident that the Health Department is ready with the response to the Human Rights Commission, because I've interrogated it, I've had interactions with the head of department, I've had interactions with the MEC. Therefore, I'm confident they are ready to respond to the Human Rights Commission within the stipulated timeframes. On the issue of heeding the call of the opposition, it's not like we are taking it lightly. When there is that call, it can be two of the things. It could be that the call is a serious one and has to be implemented, or it could just be grandstanding that any political party can do. In this instance, I've viewed it seriously, and my assessment does not indicate that you have to fire the MEC, because that should mean that the MEC is responsible. First of all, I must first satisfy myself, was there a dereliction of duty on the part of the MEC, which I haven't established? If I then fire the MEC to just be a sentimental feeling, but I don't think that that is fair. I have to be fair to the MEC, I have to be fair to all concerned. You have heard in the statement, there are issues that are beyond this head department's control. You have heard as well when we explained, there has been interventions. There has been interventions. Their adequacy may not have satisfied the situation. The intervention of Treasury comes with finances, as you can hear, which could not be there. You couldn't say the Department of Health must automatically have finances. Can't. They have to be approved. Treasury must find them, and Treasury must be able to account on them and then channel them to the Department of Health. Now, all this do not mean that the MEC, if the MEC had access to finances, to financial resources, and did not utilize that opportunity, it would have been something else. But that is not the case. Pressures of that department are eating into the budget. The reprioritization of the budget is mainly to deal with priorities and saying these are priorities, and some of them have to be accommodated, have to do with the challenges that we've got now. And we're still working on the process. And in my view, there is no case as yet for any firing of the MEC.
Most of you colleagues here who are in this room, and I know Chelsea, I saw her driving a very expensive car. You buy a particular equipment at that with a contract being embedded into it. That is why when you go and you just take your car, they service it, and you go and collect it. There was a dispute early with the person or with the company that sold the machines, which was TechMed, doing that on behalf of Varian, to to say, is there or is there no contract maintenance here? And there were therefore disputes that we ended up having to get Provincial Treasury to advise us. We think we are paying double here. We are paying what is already embedded into the price, but over and above we are told that no, that thing was not there. And therefore that dispute is what ensured. And Provincial Treasury advised us, for as long as, look, we have not found another company that could do just as good, you need to actually continue with this type of a very confusing situation, somebody double paid. So we had to report that to Treasury because in any event, it was like an irregular expenditure when you spend while you are buying the same item. But then we are correct, somewhere along the lines, in trying to save the situation, I've just been given a report now that confirms that a company that you are saying, the minister was referring to, TechMed could not have been unaware. They were the ones who are the agents of variant, so they were the best in terms of servicing the machine that they know. So when all those challenges were breaking off, the company that came in and was appointed to take the maintenance contract was actually appointed. Two things, in a manner that is violating the PFMA, and secondly, which probably proved that they were probably not competent enough to the job. So those are processes. So I wanted to say, while we are landing in this dilemma, it should always be recognized that there's always been an effort to try and do the best, and the best in terms of within the budgetary constraints and within also the advice from Treasury. All those processes were taking place in that regard.
Okay, yes, there definitely are systemic problems in supply chain management, and this is our strongest area of intervention as Provincial Treasury, and we are using Section 18. Section 18 effectively means that Provincial Treasury will be controlling supply chain management until such time as the proper financial management controls are in place. It's not a total Section 18 over the whole budget, it's just on procurement. The kind of problems that exist, well, and it's not just limited to the Department of Health, but it is prevalent in the Department of Health, is the contracts, the problems with contracts. And what we are embarking upon is an extensive contract review of all tenders that have taken place. And as has been mentioned by Sama, is that a lot of contracts they haven't been re-tendered, and they are continuing on a month-to-month basis. Now that places the department at extreme risk, because if that tender had to stop, it also you must know with tenders that you must have built-in mechanisms to make the service providers accountable. And on a month-to-month contract, those kind of risks creep in terms of making service providers accountable. We are going to be taking stock of all tenders in Department of Health, and we are going to normalise the situation. So to bring these month-to-month contracts into proper contracts. But it obviously is going to require tender proceedings. Another hat that I wear is that I oversee bid appeals tribunals. So when there's an appeal against a tender, it comes to me as the MEC for Finance. There have been a lot from the Department of Health, which is another indication that there are problems in the tender review process. We will go in there and rectify that, so that to ensure that procurement going forward is going to be ironed out. Dr. DHLOMO has a very difficult job. It's not just a matter of sitting in Pietermaritzburg and controlling health from the Department of Pietermaritzburg. Procurement happens at a district level. And so we have to put proper financial controls in so that it spreads right throughout the province. So you can conceptualize how difficult it is to address that problem immediately. But we have put very, very strict time frames with respect to this. And we're saying that we are going to be finalizing the contract register by August 2017, and that all tender backlogs will be dealt with by no later than January 2018. And we want to ensure that these period contracts will be finalized by May 2019. So we've set very, very stringent guidelines for ourselves if we have a problem in meeting them, we will engage with the public. But I have got a really good team in there, and we're working very closely with the Department of Health. I am convinced there will be a turnaround.
When we are showing signs as the Department of Health of over-expenditure going forward, which we have already had because of other pressures, the department will err on the side of challenging your human resource. We continue buying food, but we are not here to really say, but why did you not buy food for the clinics and hospitals? We continue to buy food. We continue to pay laboratory services. By the way, another credit to this department and this province in particular, of the 4.3 million South Africans on treatment for ARVs, 1.4 come from this province. Not one day have we run short of giving them ARVs, maybe 1 or 2 days or 1 or 2 patients out of this 1.3 million. So when we commit to give them ARVs, because we know that if you give them ARVs, you must give them continuously. That 1.3 we give. We also need to make sure that we buy the linen and the shit. So at the end of the day, you err on the side of not fooling your, not employing your staff. One nurse resigns, one retires, you don't fill that post because we are trying to save costs because you are going to have expenditure. That in the long run will show by that nurse, that doctor, just getting a low morale. Why am I overworked like this? Not once, not twice, every day. And therefore the low morale of staff will show by some of them, therefore just say, look, let me just leave here. I had committed to be in the public sector, but not this way. So then will resign out of those pressures that they have. Some will resign because they already did want to go on the private sector, and therefore they will leave. I must not hide the fact that some could also have resigned because of the conditions not being optimal. As a doctor and nurse, I need to find all the tools of trade there fully serviced, fully functional. So some of these challenges that we have just talked about could as well have led, and I think they have, because I used to be phoned by patients, but where did this patient got my number? And the patient says, I got it from the doctor who was treating me at Addington. He said, you know what, you don't have, this machine is broken, it was broken yesterday, I don't know what to do for you, phone the MEC. That's when now we come to say, because the doctors there are frustrated also when they can't deliver the service that they know is looking after patients because of the broken machine. So some of them will not give the patient a phone number from the MEC, they'll just leave. So it will be a variety of all those pressures that some of them are made by our association, or some of them are systemic beyond our way. And we probably, we need to review how long is this piece of string, how long can you keep on not replacing your staff and relying on those that are there, because they are going to be one-off and just collapse or make mistakes. In fact, the statement that was made by Sama was very strong to say, you're trying to save money by not employing more staff. The very few that are remaining will start and have mistakes, and you'll then be litigated and you have to pay more for medical legal leakage. So those are issues that you're grappling with in the midst of all the challenges that we face within this age.
I just wanted to talk to the accounting officer issue. Yes, he is new, but he's a very seasoned official. He headed the Nkosi Albert Lutuli Hospital. It would be very unfair to lump the problems in health onto one official. But in terms of the PFMA, the accounting officer is accountable. That's why the name of the accounting officer keeps on coming up, because it's in terms of the law. So the buck stops with him. But he has personally reached out to Provincial Treasury, not once, on many times, to come for our assistance. So he has the humility to do so. And he's been working very well with Provincial Treasury. Yes, there has to be consequence management if there is and I think that there have been a couple of forensics, and out of forensic investigations will be recommendations for disciplinary action. That has to happen. It might not just be the accounting officer, it could be other people as well. But upskilling, absolutely. One of the major areas that we have identified as Provincial Treasury is the need to train people in financial management controls across the areas that the Premier covered.
We are looking into the report. We will specifically be looking into the recommendations of the Human Rights Commission and attend to it. We will know, because some of us have not had this face-to-face discussion, but in the report they do mention some of the patients who are alive, who are indicating that I'm fine, but however I was delayed by 3 months, by 4 months. I would have wanted to access this health normally within 2 weeks or within. So we will have to explain that, and if you probably find space and time to read my executive statement that I read there, it shows a particular way of how to deal with this matter. One, I must understand that the machines do break and need repairs. But again, sometimes because not only are we looking after patients in KwaZulu-Natal, we are also supporting the part of the Eastern Cape, Swaziland and Mozambique. You then would have to work within that confine, and looking after cancer patients is not a once-off cold and flus and you are gone. You have to put them on a program that goes up to 5 years. Make sure that the effort you put on the first year has the results, because the cancer must not come back on the third and fourth year and you are not waiting, you are not watching. So you then have a very complicated program which says, please don't miss your date on day whatever. Come back to Nkosi Albert Luthuli, come back to Addington on that date, so that you're not encroaching on the other patient's date tomorrow. However, things happen that on that date you religiously come and we are found wanting in terms of your appointment in the machine. Or you don't come because of other situational problems, and then you come on another date and we can't treat you because of the huge volumes of patients that are allocated for that day. So it is quite a lengthy process in that regard, which is actually a bit complicated. But that also now is going to be taken care of, as one of the colleagues that did ask, get Addington back to function properly. All these backlog challenges will be the thing of the past.
The purpose of this press conference is not to say everything's great. So please, and that we're not here to make excuses. We acknowledge that there's a major problem in the Department of Health. And our plea to the public is for an understanding that there is no one quick fix solution. This is a very complicated issue. It's going to require intervention, it's going to require resources, and we don't want to fight with stakeholders. We want stakeholders to work with us. A lot of the stakeholders that have raised issues are highly professional people in the health sector. We need their advice, and they could be identifying things that we've left out. So we want to be able to we really are committed to working together to finding solutions. We have proposed interventions. Those interventions could grow. They could be bigger interventions the more we do get into the department, and we have set ourselves very strict timelines. We really are working to meet those timelines. Things could happen that stop us from doing so, but we want to keep you informed. So it's not a situation where it's a surprise. So I really, both myself and Dr. DHLOMO and on behalf of the Honourable Premier, we really look forward to ongoing engagements of this nature. Dr. DHLOMO and myself and the Premier took this to the Provincial Executive, because we are a collective, to get a decision on what our interventions were. Our next step, of course, was that we had to report to the Legislature. We are accountable to the Legislature. The very next step in this process is the engagement with stakeholders. It's not going to be a once-off engagement. We are going to be engaging with them with very deep commitment. We want them on our side. We want to work with them because we actually want to remedy the problems that exist in this province.